Hi guys, welcome back to EmpoweRN. Thank you so much for joining me. So today I had a really cool video request from Nurse Crystal. By the way, just wanted to give a shout out to you, Crystal. I really love your interactions on my channel. Your comments always light up my day. Thank you so much for for watching my channel and participating. I really look forward to hearing from you with every video that I post. So thanks again. But she asked, can you do a video on confidence in nursing, how to build confidence in nursing? And when I saw that, I just thought that was an amazing request, because confidence is something that a lot of nurses do lack. And I think it's for pretty obvious reasons. If you want to think about it like this, as a nurse, it's one of the most beautiful professions that I could ever imagine being in. We, help people every day. We, spread a smile wherever we go. We can be such beautiful, compassionate, loving people. And at the same time, it can be one of the scariest professions that I can imagine, because, in one instance, you can have people crash on you. In one instance, you can make a deadly mistake. In 1 second, you can miss over something that was very important. So with the severity of the mistakes that we can make, it can be very, very hard to have confidence as a nurse. I've experienced a lot of times in my career where I have lacked confidence, and what I have found in myself, and I think that you probably could have a similar experience, is that when I did lack confidence, I had a major fear. Usually that fear was in the form of making a mistake that could ultimately cost me everything. And when you think about that, when you think about making one mistake that could cost you everything, how does that make you feel? Take a second and think about that. How does that make you feel? And if you're like me, it doesn't make me feel very good. It makes me feel disempowered. It makes me feel out of control, and it kind of makes me depressed. But anyway, so let's examine this. If I have a fearful thought that I could ultimately lose everything, then it's not going to move me forward. It's not going to help me think clearly. It's not going to help me move forward and take the actions that I need to take. It can kind of limit me and make me feel like I don't want to do anything because I'm scared to do anything. But what I have found, and this is what I do all the time, is when I'm having a fearful thought, I know that I can't not think about something. Because the more you try to not think about something, the more you're just going to think about it. So you have to replace that thought. And what I replace that thought with is, how can I use this fearful thought or use this fearful event to make me a better person, a better nurse, and to learn from this experience? So let me give you guys a real life scenario of something that happened to me. One day, I had multiple patients on the medication Dilaudid, which is the strongest pain medication that nurses can give on the floor anyways. And I had 4 different patients on the same medication, all getting different doses. Somehow I got, mixed up in my mind, and I gave the patient the wrong dose of the medication because I was thinking in milliliters instead of milligrams, which, thinking back, it's a stupid mistake, but I'm happy to share this with you so that you can, hopefully learn from my mistakes. So what happened was, I realized that I made the mistake, and not only had I made the mistake once, I had actually done it the first time I administered the medication as well. So I sat there and I thought about that, and I was like, okay, Caroline, how retarded is this mistake? On a scale of 0 to 10, it's probably up there, about a 10. So I was like, okay, well, I'm feeling very disempowered right now, and what could I do to make myself feel better, to make the situation better, and to ultimately come out of this a better person and a more confident person? So I thought about it, and I was like, okay, well, of course I have to do an incident report, but since I'm agency, I don't develop really the relationship with the staff that, you know, a lot of nurses do. And of course, with the staff comes the director. So I was like, all right, well, I have to face this head on. With the mistake, I'm going to show her that I can, you know, not only take care of the situation and have her trust me with her patients, but she can also see that I'm a very confident person and that this mistake won't happen again. So I went to her and I said, you know, I told her the mistake and I composed myself very nicely. I had very good articulation and, you know, ultimately told her what happened. And, you know, it was a mistake and we examined it and, you know, she asked me a few questions and it was an uncomfortable situation. But what I realized was that I came out of that as well as I possibly could have. And ultimately, I used that as leverage because that mistake helped me have interaction with the director. And, you know, ultimately I was able to talk to people that I wouldn't ordinarily talk to. And she was able to see how I could compose myself even in very stressful situations. So having the lack of confidence, you can replace that with, no matter what happens, I will build from this and I will learn from this and I will ultimately become a better person. So guys, it's all about replacing those fearful thoughts with thoughts that are going to serve you. So again, I love hearing from you guys. I'm going to open up, you know, the comment section below if you guys have any questions or need clarifications, or if you have any other video requests. I love hearing from you guys. I love getting the emails every day. It's so cool. This is what I'm really passionate about, and which is you. And thank you so much for giving me this purpose and for your interaction. I love you guys, and I can't wait to see you next time. With love, I'm Caroline Porter Thomas. Bye.